Okay, so welcome to the School Nurse Corps Lunch and Learn. Today is Friday, November 15th, and we're going to start out today's presentation with our two guest speakers. We have Kim Hudgens with us from Life Choices of Wenatchee Valley, and she's being joined by their staff physician, Dr. Lisa Peterson, and they're going to be providing us with some information about the services that they are recently started offering in the area. Right.
Well, hi, thank you for seeing us this morning. We're very excited to be here and to share our free services with you. We always hope that this will not be something that you and your students need, but we know the reality of the situation. So we're here for, first of all and foremost, we are here for your students. When they're facing the idea of an unplanned pregnancy, they're going through a wealth of emotions, and we're trained for that here, and we're here to provide some free services. So we're going to talk about those services, and then if you have any questions, feel free to ask. And I have Dr. Peterson here. She's been with the organization for over 6 years, so I'm still a rather new director here, so Dr. Peterson will come in handy with some of the questions. So I'm just going to go through some of the services that we provide. Of course, everything that we do is free and it's confidential, and we are a pregnancy medical clinic, so we are a full pregnancy medical clinic. So I'm just going to go down the list here.
Can I see those slides?
Yeah. So some of the things that we do, we offer free pregnancy testing, free ultrasounds, free STI screening and treatment, prenatal parenting education. We have a great program called Earn While You Learn, where the girls and their partners can get some parenting classes, and we're going to talk a little bit more about that a little bit later on, but that has been a big program and a big service we've been able to provide for people. We also have post-abortive support groups, if that's something that somebody needs, and community referrals. Really we're here to empower the women. We give them education and truth, and of course compassion. We love our clients. So as far as the pregnancy testing, we offer free lab quality urine pregnancy tests, and it would be performed by a nurse or a doctor. As I said before, we have Dr. Lisa Peterson here on staff. We also have Linda Bush, she's the nurse manager. One of them is always here in the clinic on staff, and then we also have nurses that volunteer their time here, and then we have advocates as well who also volunteer their time here, and they go through some intense training as well to be here. We do have a limited obstetrical ultrasound exam. Again, that is free, and it's just to confirm the presence of a viable pregnancy, as well as determining the heart rate, gestational age of the child, or the gestational age of the fetus at that point. We are providing STI testing and treatment, and you can look there at our slide to see some of the STI testing or screening that we do. That is all free to the girls, and then we also offer free treatment for that as well. And feel free to step in if you need to at any point. So getting back to our Earn While You Learn, if our client is pregnant and they are wanting to go through parenting education classes, we have a curriculum that we use. It's called Earn While You Learn. It's a video curriculum. They come in here, they learn through the video, and then the nurse or the doctor or the advocate will go in and ask them questions and kind of work through the program with them, what they watched, what they learned, if they have any questions. And we have a boutique here as well, with free items for the baby, and some maternity clothes for the mom. So they're always welcome to get any materials there that they need. And then they're also, as they go through their classes, once they've reached 12 classes, they can order a brand new car seat, stroller, high chair, pack and play, and we order that brand new, and they can pick the color a lot of the time. We actually had, my first week here, we had one client walk in, and she had done enough classes, she was walking away with 3 big ticket items.
Mm-hmm.
So they can keep earning points for that, and that's very helpful, as you're dealing with having a new baby. Of course, this is our Surrendering the Secret. It's a post-abortion support group. If a young woman is finding that she's struggling with that decision, then we do have a support group for her, and they meet throughout the year. And we're on all the social media sites, so feel free to link in with us and see what we're doing, and see what kind of new news we have. And that is pretty much what we offer here. I'm sure that you guys have questions. I'd like to leave that open to you.
Good job. Okay, Kim, could you let the nurses know where you're located?
Oh, absolutely. So we're in Wenatchee. We're at 351 Orondo Avenue. It's actually a brand new location. It's beautiful and clean, and it has the new building smell to it still. And you are always welcome to come get a tour if you'd like. We're always available to do that. Just call me, let me know, and we'll set it up for you. Or if you have students or teachers or anybody who wants to come check it out, they can.
Okay, and what are your hours of service?
We Monday through Wednesday is 10 to 4, Thursday is 10 to 7, and Friday is 10 to 4. Yeah.
Do you do any data collection on pregnancy rates in the region?
That would be at least.
I mean, we do stats here. We keep track of how many pregnancy tests we do a month, and how many ultrasounds I do, how many STI testings we do. All the positive STIs go to the public health department. But as far as our stats, our pregnancy stats going to like the public health department for teenage pregnancies, I don't think our stats are incorporated into anybody else's stats.
Okay, all right.
Is that what you're asking?
Yes, yeah. I just and I was kind of curious about our current pregnancy rates for teens in the region.
Yeah, I understand. I've just been in contact with like the Chelan Douglas nurse partnership program, where those 2 nurses are partnering with first-time moms, and so they say that we have a higher number of teenage pregnancies in these counties compared to other counties in Washington. That's what they say.
Yes. Yes. Well, I'm glad that you're connected with them, because that's a great service also that's just beginning.
Mm-hmm.
And they presented to our group in the past. So good. All right.
Another thing I was thinking that might be helpful to you is to understand, from beginning to end, what a visit would be like for one of your students if they were to come in. Would that be helpful?
Yes.
To you, Lisa, would you like to kind of share that?
So every person that comes in is treated the same. It doesn't matter who sees her. We follow something called client linear flow. So everybody is going to give us, after making their chart, just the demographic paperwork and stuff, we bring them in the back to get a urine sample. While we're running their urine pregnancy test, we have them fill out a decision guide. So decision guide is a tool that helps us know how to help them. It's looking at all her parenting options. It's basically an options education decision guide. Every woman has the choice with a positive pregnancy test to parent, adopt, or abort. So it's helping her looking at all those decisions, and we kind of see where she is with all those, what her knowledge, what her values are, if there's anything that might change her mind, who her support people are in her life, just what would be a easy thing about that decision, or what would be a hard thing, what would be a benefit, what would be a risk. So it's a really great tool. It helps us know where they are in their decision-making process.
Because our policy is we don't tell anybody what to do. It's not our place. We just provide information and education so that they can make an educated choice. So as they come to us, I wish you could be here to walk around, and it's very comforting and cozy here. But they come in, they're greeted with a smiling face, somebody who's very happy to see them. We find out why they're here. We have a reception desk. And then, if it's that they need a pregnancy test, then we go back in the medical center. There's a special room that's has a couch, and it's cozy and nice pictures, and it's a place for her that once she's had a pregnancy test and she's waiting for the answer, she can sit in peace and know that she's comfortable and safe. And we'll do an intake with her, and if the pregnancy test comes back positive, then that is when we will go through the options with her and just share all the information about the different options that she has. And generally, how long is a visit if somebody's coming in for
a typical pregnancy test appointment is about 45 minutes. If they're really in crisis and they want to talk through their options and have an ultrasound, they could be 2 hours or more. I think that's the beauty of it. In regular medical clinics, most doctors get a 10-minute appointment slot for people. And then here I could spend 2 hours with somebody in crisis. So that's the beauty of it.
Yeah, it is. Oh, sorry, Kathy, we can't hear you.
She's muted.
Which counties do you serve?
Which what?
Oh, which counties do we serve?
Anybody who, we don't have any limits on who we serve. So, people come from Moses Lake and Soap Lake and Chelan and Ellensburg. People who are just in the area visiting family from California or Texas, or it doesn't matter. Anybody who walks through the door.
Very good.
Yeah, and because we're completely free, we're not taking insurance information. We just don't have those kind of regulations. We can see anyone. Oh.
Sarah and Kristen, do you have any questions?
Are you guys a similar type clinic to New Hope that's in Moses Lake?
Yeah, New Hope, I believe, New Hope is also like a pregnancy medical clinic. And I believe they're also offering limited obstetrical ultrasound as well. Right.
Yeah, from what I understand. So I was just, you're telling me this, I'm like, I think that's very similar to what we have closer.
There's hundreds of pregnancy medical clinics across the United States. Offer pretty similar services, but each is a local ministry in and of itself, funded by just the local community.
Okay.
And we are 100% funded by donors as well.
Oh, so. Wow.
Mm-hmm. Yeah.
That's great.
Yeah.
How often do the post-abortive groups meet? You said, was it once a month? Is that what you said?
So we have, I believe the classes are 8 to 10 weeks long.
It's 8 weeks. It's once a week for 8 weeks.
Mm-hmm. And those, we run them generally about 3 times a year. And they're pretty, if we had, they're pretty open to doing whatever they have to do to serve whoever is in that position at that point. So if there were some girls, some teenagers who had been dealing with that, then I'm sure they'd be open to running a special class for them if they needed it.
Sure. Yeah, that's awesome.
Do you offer that type of meeting but in any distance format, or would a high school student need to come to the clinic to participate in a class like that?
In the post-abortive class?
Mm-hmm.
We don't do them here in the clinic. Usually, it's so the people that are running that, they'll usually do that at a home or somewhere that is very private and very safe, because for some people it's a very hard thing. They don't want to go public with it necessarily. So we try to be very sensitive to that. Are you asking if the girls would have to come here for?
Well, since you're serving so many counties, I'm just wondering, and some of these might be high school students who would not be able to travel every week to attend a session. So I was just curious how that might work for a student in Okanagan or Omak or, Wilson Creek, where the distance might impact them.
We could refer them to there's other pregnancy medical clinics have similar post-abortive supportive classes.
Okay.
We could refer them to something closer in their geographic location.
Okay. All right.
And again, they're pretty flexible. They want to be where the people need them to be. So if something like that came up, then we would be open to working with you on that.
Okay. All right. So, Kristen, do you have a service similar to that in your area?
We have CareNet here, and I think there's an office in Brewster and Oroville and they're in Omak. Yeah, but I'd have to check in. My last understanding from CareNet was that they weren't. I mean, they do testing, but I don't remember if they had ultrasound. I don't remember that they had a doctor on staff. I know it's staffed by volunteers. And I need to find out what services they offer, because I don't really know right now, other than testing, pregnancy testing. I don't know that they do STI testing, but I don't
think
know
in the past
that could have changed.
It's changed in the past 3 months. The Upper Valley, Oroville, Washington has now a radiologist and a medical director. They're starting ultrasound services in the Upper Valley.
Awesome.
I believe they got something called a Stork bus, which is it's a traveling van with an ultrasound, so they can go to different pregnancy medical clinics operating under one radiologist.
That's awesome.
Yeah.
I was going to ask you about that, if you've ever considered doing any mobile services. Once you're up and running, if you have thought about having a mobile unit, or if everything was going to remain in the clinic itself.
I think at this point we're thinking about keeping everything here. We just got a new $30,000 ultrasound machine that needs to stay here.
And a new building.
Yeah.
Okay. All right, good. All right, Kristen and Sarah, do you have any other questions? Okay, well, thank you both for joining us today. We really appreciate it, and we're also going to be encouraging school nurses to come and take tours, and so they should contact you directly, Kim, if they would like a tour.
Yes, they should. Matter of fact, do you need my phone number?
I have it,
and
I'll be sharing that with them. And just as a reminder, also you do accept donations, correct?
We do.
And like new clothing, or gently used clothing, infant clothing, and maternity as well.
We do, and we're also looking for quilters too, because we do give quilts to the mothers when they come in with their baby. They get a layette bag with some goodies in there, and then we also have quilts that we would like to give them. So we're looking for all kinds of things. The other thing too. You're going to get this presentation, but if you ever want more brochures or flyers, or you want me to come to your school, or one of us to come to your school, we're always available to do that as well. So we can come and talk with your students about, whatever you need us to talk about.
Okay. All right, and for the record, your phone number is 509-664-5298.
Yes, that's right, 5298.
Okay.
Yeah, you can always email me as well at director@lifechoiceswenatchee.org, and you can get on our websites and check us out. And
Yeah, that's another thing. You can go to the Real Options Clinic website and request an appointment through the website.
And we did, if you are dealing with if you are dealing with girls that are wanting post-abortive support services, we do have a video on our website and on our YouTube channel that might be helpful for them to look at if they need that. We'll be uploading some more videos for all different kinds of things as well.
All right. Thank you so much. We really appreciate having you here today.
Thank you, Kathy. Thank you, everybody. You have a wonderful day.
Yeah, you too.
Bye. Good seeing you. Bye.
Bye.
Well, hopefully a bunch of nurses will watch it.
Well, goodbye.
Okay, so it's just the three of us that are on right now, or two of us actually. And, I want to have an opportunity for you to ask questions or share stories as well. The purpose of these is really to have someone come on and do, 30 minutes or so of kind of a topic of interest, and then have an opportunity for discussion. It's about 12:20. I do want to give you some quick updates, some things that are coming down the pike from OSPI and Department of Health, just so you're aware of these. For our next meeting in December, it's scheduled for Friday, December 20th. And Catherine Graff is going to be joining us from the Washington State Department of Health Immunization Program to kind of clarify some of the changes that are going to be coming down the road for immunization data entry and immunization requirements. There are changes that are going to be coming for the upcoming school year, and she wants a chance to clarify those with folks. So she would be joining us, so it'll be a good opportunity to ask her questions. A couple other things about immunizations. I am getting, I think, more questions this year than ever before about parents who are requesting religious exemptions for their immunizations. And so just to clarify the Department of Health stance on that, school nurses really don't have to investigate. When a parent says that my religion is such and such, and therefore I do not want to have any immunizations because of my religion, we really don't have to go out and try to find the religion or look it up and identify whether or not it actually does have any prevention of immunizations, in the church doctrine. If the parent says that, then we're just taking them at their word that is what they want to do. So just to clarify that, the other thing is that I am going to be asking our IT department for a list of districts who have transitioned over from the Skyward system over to Cumulative. Yesterday, there was a discussion about Cumulative. That's the upgrade to the Skyward system. And it sounds like there are some oddities in the Cumulative system around immunization entry for students. And it basically, they kind of increase the workload for data entry. So I think there are workarounds to it, and some of the things that have happened are, for example, instead of just having maybe 10 immunization types to choose from, there's probably 50. You have to go in and kind of build your own database of which types of immunizations you want to have entered into the system. And all of these things are just somewhat time consuming. And so I think this is another plug I'd like to put in for people to really look at the school module through the Department of Health, and to really become seriously considering putting that in place, because it just seems like the requirements for data entry and the work behind it are just getting worse instead of better, and that the school module is one means of getting around that. So I'm not saying it's perfect. I know that they are continuing to work all the time on the school module. Manson is a good example of a district that is now entering at least their second year of being on the school module system. The school nurse there is Michelle Rogie, and Michelle has actually been maintaining documentation in the Skyward system as well as the school module, just to test it out and make sure that it's accurate and things are pulling across correctly. And she says now that they're entering their second year, she said this year everything worked out perfectly and everything matched up, and I think that they're making good progress in regards to, you know, having the system function, you know, at a high level. So if you're thinking about it, this is really the opportune time of the year to do it, because you've got quite a bit of prep work that needs to be done to get ready for the coming school year. The Department of Health offers a lot of support in that. One of the conversations that came up had to do with, for example, the data load, getting all of your students loaded into the school module, and really, you know, most of the communication that's coming back at this point is that the Department of Health will do that. So you don't need to worry too much about at least some of those aspects of, well, how do I get it set up? How do I get my students in it? But there is some training required in terms of data entry and management. And so I do encourage you to look at the school module page of the Washington State Department of Health. The school module page actually has a full range of tools that are already built on how to get this system implemented in your district. So everything is in there from a project timeline to how to talk to your administrators about the value of the school module, to frequently asked questions and training materials. And so those things are already developed, including a complete module and really a how-to manual on the school module. And those are all located right on the same page. So please take a look at that if you don't have it implemented, or you're at least thinking about it, so you can see what would be involved in getting it set up. It will probably take you from, you know, I'd say at least January to June to kind of get ready for, not because it's just a constant workload, but more because you've got to just work through the processes that need to be done in regards to training and data checking and things. So to get that done and get it all ready so that when it comes to August and the next school year, you're really ready to go. Okay, and then before we open up to other questions, just some quick reminders for your calendars. I want to make sure that you have some dates down. January 31st will be our next face-to-face meeting, and that will be in Wenatchee. And the presentations on that day are going to be the Children's Hospital full-day workshop. So we're going to be logging into that remotely and offering it at the ESD. Another date to keep in mind will be May the 6th. Yesterday we found that the routine OSPI session that's always done on that day in the afternoon is not going to be scheduled after all. So we're going to fill the day. We will have guest speakers coming in. We may do some of it in a similar format where it is being launched remotely to all ESDs across the state, but we will definitely have a full day of education offered on the 6th. Couple of other dates. We are going to be doing another nursing orientation program as well as some Skyward orientation. And the dates we're looking at are December 16th and 17th. We are not open yet at the ESD for any use of training rooms, so we're looking for rooms to do that in, and I'm sure we are going to find some. So we will have a full day, a full classroom day on Monday the 16th, a half a classroom day on the 17th, and that will be followed by a half a day of the Skyward Health Services module training. When these get set up in the PD Enroller system, I'll send out a link so that people can enroll in those or help other people get enrolled in them. And they will be entered as separate entities because we do have some folks who want to just come to Skyward, and because they haven't had a lot of training on the Skyward Health Services module. So that will be an individual registration process just for that afternoon session. And then you'll also have an opportunity for the Monday, Tuesday classroom session. That is going to be set up as a bring your own device, which is a kind of the method we're going to at this time at the ESD. No matter where we do this, we probably aren't going to have a computer training lab available to us. And so we're asking anyone who has a laptop to bring it with them to the training, and we'll be doing a head count of how many people do not, so that we can provide them with one. A couple other things we don't have scheduled yet, but will be coming up in the spring, will be some repeats of the school nurse case management presentations. The presentation has been updated somewhat, and we do want to continue launching those out to all school nurses in the region. So we're probably going to be doing a full day session at somewhere in the Lake Chelan area, and then another full day session in the Quincy area. And we'll get the dates out to you as soon as we have identified some locations and made arrangements for those trainings. Okay. Do you have any questions or concerns, or would you like to do some updates on how things are going in your districts?
I will say we finally jumped and put all of our daily medications on Skyward, and I started that last Monday. Oh no, I'm sorry. Well, I guess we did. I set it up on the 1st, and then we started it on Monday the 4th, and then came back today and had a lot of bugs to fix. Yeah, but the staff were liking it, so that's good. But we had to kind of redo a few things and stop some and start again to get the inventories correct, and definitely some learning involved. But overall, after spending a couple hours this morning fixing everything, I think we have it all figured out now. So they are liking that, and it seems to be working. So it's definitely lots of playing around and getting it right. And I'm still trying to figure out how to print maybe some kind of a report to say, I think our secretary figured out some of it, but I'm gonna have to play around a little bit more with to see if I can get a report for not just one student at a time, but to get a report for all students maybe over a week's time to see which ones have been missed, because otherwise you have to go back in day by day for the scheduled meds to see which ones were forgotten to log, or that the kid didn't come in that day, so the staff forgot to look at it, and then we also figured out that they need to have open like medication quick entry for the day so that they know which kids have come and not come, and to have that kind of be a check at the end of the day, because often if the kids don't come in or they forget to come, or the staff, they miss their window and then you haven't logged anything, and so then they're out of the time window. And anyway, yeah, so just some things to work through and figure out. But so far it's good, and they like it better than writing. So
okay, good. All right, and could you share any of the thing when you talk about having to redo things in the system, or to make corrections to that? What did you find that didn't work well for you?
One of the biggest things was we have when kids have they come in for maybe a lunchtime and a breakfast medication, not realizing that, and let's say their medication comes out of the same bottle, we wanted to inventory that, but it's at 2 different scheduled times. And so I didn't realize at first that you could have 2 different schedules for a medication on the same med. So I thought originally we had to have 2 separate medications logged in, when really we didn't need to do that. So it really was that it was just two separate schedules within the same medication timeline, or the same medication log. And then it pops up separately down below for the administration. Or if you do quick entry, it would pop up in two separate things, two separate lines for them to click on. And then you can have your inventory out of the same bottle and it would count correctly, because it's from the same one rather than two separate ones. So working through that happened a couple times, especially when there was a dose change involved, like a kid who has the same bottle for both breakfast and lunch, but the morning was 2 pills rather than 1 for lunch. And so that messed up, that initially messed up our, our count and things and how to fix that. So we got it all figured out. And you have to be so careful because any change you put in or can change the count, or if you have the max dose wrong for the day, that will affect your count as well, or make it so that you can't administer a med if it's out of, if that max dose is not correct. Another challenge we ran into was how to stop one of the meds that we had messed up, that sometimes you can't, there's certain things you can't go back and change once it's in there. And I can't think of what exactly it was that we were trying to change, but we had scheduled it, and trying to stop that when something was already scheduled, it's multiple steps because you have to go in and stop the schedule, and you also have to stop the med and make sure your end dates are correct for when you wanted it stopped so that the counts are correct for those days. And so it's actually a very calculated input. And if your dates are wrong or your times are wrong in any way, shape, or form, it will change your counts or inventory for certain medications. Yeah, so it's been quite the learning experience, but thankfully our secretary is pretty tech savvy as well with Skyward, so she and I have been kind of working through it together. Yeah, this morning we spent the first half of the morning figuring all those things out, day by day, going back and having to fix the things that were missed for kids, because we had half days involved and kids were, forgetting to come in, or right at the end of the day, and so some of them don't take out half days, so it was an interesting mess, but we got it figured out.
Okay, good. Well, good. That's good news. Thank you.
Yeah.
Kristen. Oh, you're on mute though.
I couldn't see where to unmute myself.
There you go.
Yeah, so all I can think of right now is, we had an exclusion date for immunizations on the 5th.
Mm-hmm.
So I think it's going better this year. We're just down to a few that have appointments, and I think one in the district that we still really haven't had communication from. So, and that's an MMR personal exemption. It's funny, we've had so much communication with the families with the MMR personal exemptions, and they're the ones that have been the biggest problem to, get an appointment and go in and take care of it, or even to communicate with us. So anyway, so that's been pretty consuming, or at least last week it was. Beyond that, I'm not really sure. I just feel like this year has been, I feel like I'm playing catch up with my laptop issue that really limited what I could do, and then the school nurse starting and having to train her. And so I feel like I'm just playing catch up in the buildings that I'm in, trying to see what needs to be done and who still doesn't have medication forms and things like that. So that's kind of where I'm at, is just playing catch up. Mm-hmm. Feels like, and it's very freeing to be able to do that, because I feel like I was pretty tied to North, other than putting out fires here and there. And so to actually be in the other buildings for a whole day and not be traveling to another building, it's miraculous. So yeah.
Good, good. Well, I'm glad to hear that's working out, having her pick up that one school. Do you anticipate that she will pick up other schools, or
I don't, I don't really know if she will. Um, I think she keeps herself really busy at North. It sounds like she's really good at communicating. When she does emails, she includes me in all the communication. So she's got a lot. There's a lot up there. So I guess we'll just see what happens.
okay,
Yeah.
okay, good.
Yep.
All right. Now, will you be planning on having her attend the orientation program?
So is that the December 16th and 17th?
Yes.
So I will mention that to her. Yeah. Yeah.
Okay.
She's just this week looked at her. She has, the district gave her so many hours, and she's scheduled at North Tuesdays, Wednesdays, and Thursdays. And it sounds like the number of hours that she has doesn't really even get her through the school year. So, but she's willing to play with things, and she might also need to be gone in March. So I'm sure there might be some wiggle room. So I will certainly let her know about that.
Okay, and I'll be sending her a note as well, and there will be a note going out to the principals or the superintendents at districts who have new nurses, just as a heads up to them, to let them know that this is coming up and you may want to have people attend.
Okay.
Okay. So could you give us a little overview of your Healthy Washington program that you're working on?
So I'm not really working on that, Kathy.
Okay. Is that who is going to be working on that project?
Well, so it's Dean Agee is we lost our lead, and so he's the PE teacher at East. So he's now the lead.
Okay.
And I mean, all I can say is that I went to the meetings in Wenatchee last May. Marilyn, actually, there's the focus on the framework training today,
Right.
and Marilyn wanted to go to that, so she went to that, and it's just as well, because I woke up not feeling well today, so I'm glad I'm not traveling or far away. And that's really all I know. I feel like I've just been buried this year. So that's really not even been a thought, other than I have notes, from the training that I went to about things that I'd hoped to do in terms of case management of certain students. But really, I've just not been able to really incorporate that this year. Yeah.
That's okay. All right. So is there something that I can help you with? I know coming up, probably in December, to meet with you and also with Lacey in Okanagan.
Okay. For the I can't even remember what you call it, where you check in and
Yes, yeah, for your site visit, but
site visit.
But in the meantime, is there something that you could use help with that would make things easier for you?
No, it's just time. And it's really been, I feel like I've just been back in the buildings, in the other buildings. It's just been, I think this is, I don't know, maybe this is my third week. But then immunizations, because I do the bulk of it and it just becomes all consuming, getting ready for the exclusion date and then dealing with the aftermath. And, I looked at my contract again prior to the exclusion date, because there were administrators that wanted me to do even more, and just had to point out that my contract says I'm a consultant with immunizations, and I'm not doing all of the letters and the phone calls and everything, but it works out. That's what I do. Otherwise, it doesn't necessarily happen. So. And we've had our screenings. We've done 2 of our vision and hearing screenings, and we still have the middle school yet to do. So it's just all of that beginning of the year stuff, and I don't really think there's anything that I can think of that I would need help with. It's good to be back in the buildings.
Okay.
Yeah, to be able to see students and do assessments, and who doesn't have medication forms still, and and things like that. So, and then just everything that happens during the course of a day.
Okay.
Mm-hmm.
All right. Well, good. Well, I'm sorry you're not feeling well. I hope you're feeling better tomorrow.
Yeah, I hope so.
Okay. Well, do you have, either of you have any other questions about anything that you've heard about that's coming up?
Well, I'm sure Catherine Graff will talk about the law change.
Yes.
I know we're very curious about that.
Yes. Yes, she will be covering that.
Yeah, I'm thinking that the school module might be pretty important in regards to that, and then in just getting ready. I mean, if students have to start with immunizations and everything in place on the first day of school, there's going to be a lot more legwork, and then the enforcement of that is going to be tricky.
Right. So this will be a good opportunity to ask her questions about that.
And when I mentioned it to a secretary, and I'm sure it can't be connected, but that they have a hard time getting immunization records and CISs signed, and as well as birth certificates. So she said, "You tell them, you tell the powers that be, they should attach birth certificates to that, so that it's required that they have their birth certificates, because it's hard for them to get those too, I guess."
Well, yeah, and transfer students, and we're waiting for records from other school districts.
Mm-hmm.
I mean, I don't think they understand the amount of work this is going to be. And how many kids are going to miss the first however many days of school and miss out on their education and getting started on those first few days of school integrated in their classrooms and social, emotional connections with other students and their teacher that they're going to miss out on because they're not going to be able to be there. And I think it's going to impact a lot more students than they realize.
Well, I hope both of you plan on joining on the 20th so that you can express your needs clearly. Catherine. Another quick update is we did hear that the OSPI memo and recommendations for Narcan in schools should be coming out hopefully within the next couple of weeks. They are working on a policy with WASDA so that there is a policy template that they'll be encouraging districts across the state to use, informing their own policy. And then we have funding available to help with any expenses that you have. If you decide that you want to use Narcan as floor stock medication, make it available in your emergency kits, then you shouldn't really have any expense associated with that or associated with training expenses either. We would be covering that for you. So whether it's, training tools, policy implementation, policy training, staff training, we can help you with those things if you would like that. Okay.
Okay.
All right. Well, then, if you have no other things that you would like to share with the group, then we will log off for today.
Okay.
Thank you.
All right.
Thank you.
All right. Thank you so much.
Yeah,
Okay.
thank you.
All
Bye-bye.
right. See you later. Bye-bye.